Hey everyone, Biohacking Blondes here with Alex and Molly, and we have a special interview guest today. It's Emil Nardone. He's a doctor of chiropractic. We're super excited to have him. We haven't had a chiropractor before, and we love, love, love our chiropractors. We could not live without them. So I'll give you a little bio about Emil, and then he can talk a little bit too. Dr. Nardone went to Fairmont State University, where he received his BS in biology and a minor in chemistry. He then attended the Southern California University of Health Sciences in Whittier, California, where he was awarded his Doctor of Chiropractic degree. He received his Juris Doctorate degree from the Charleston School of Law in Charleston. That's pretty cool, South Carolina. And most recently, Dr. Nardone retired as a professor and clinician at a chiropractic university. He has been practicing the science, art, and philosophy of chiropractic for over 2 decades and is a veteran of the West Virginia Army National Guard. And from a brain down perspective, he practices a gentle spinal cord stimulation by using his certification in the zone technique. He uses the innate principles of healing, both personally and professionally, to bring miraculous healing to himself and to his patients. Dr. Nardone's philosophy in practice is simple: fix every single patient as efficiently, as consistently as possible from whatever ails them. Results are the driving force behind his work. Fabulous. Emil, we're so excited to have you. Thank you for being here.
Here as well.
Great. So Alex, tell us how you know Emil or how you met him.
Well, so Emil, I met on the beach actually through my friend Marika, who is the gatherer of all fabulous people here
On
in
the
Vero
beach.
Beach, and on the beach, and we all meet on the beach. So living in London, you would obviously meet out in the clubs or whatever. Here, you meet on the beach. So that was Emil, and he strikes you because he's like this big giant. He's like a Viking, yeah? And he's a force, really. Emil is a force. I mean, he is different. And his style of chiropractic, I've had a lot of chiropractors work on me in London, actually, kind of all over the world. And he is one of my favorites. It's not my favorite one. I think he's fantastic. But I also love his philosophy because it's more than just adjusting to a meal. And that's why I'm really interested and excited to have him here on the show today to tell us more about what is his philosophy. And I know it stems back to the founder of functional medicine. So Emil, welcome and tell us a little bit more.
Yeah, I've been a chiropractor for, 25 years. My journey started back in the hills of West Virginia, right? My mother was a German woman, and she had 13 leg surgeries. So I had a brother, so we were pretty rambunctious boys. So, we would drive her crazy, and she'd chase us around and yell. But most of the time it was because she was sore and in pain. But when we were young, you would always know when she went to the chiropractor, because I would come home and she would have Kenny Rogers playing and singing, and she was calm.
Like, I'm feeling good.
Yeah, still to this day, I still see Kenny Rogers as kind of like calming to me because of those situations. But one day I was in the chiropractic office with her, and I started reading the philosophy of chiropractic, and I was probably 12 years old, and the bells went off. Like, this philosophy makes total sense to the medical philosophy that I always questioned, the symptom approach, and that led my path to studying biology and on my way to chiropractic school, and here I am today still doing it. So that's how I became into chiropractic, and I love it. It's like a great field. It's just so rewarding to be a chiropractor.
Oh, absolutely.
And Emil, can you also perhaps tell us about your wife? I mean, you were part of her big healing.
I was, so I started a chiropractic practice in West Virginia. Like, in my career, I've treated over 8,000 patients. I've given 1 million adjustments, probably, is what I calculated.
Wow.
And yeah, I was a very structure-based approach to chiropractic. Basically, the philosophy was, the bone was putting pressure on the nerve, and the nerve, if you remove the bone off of the nerve, you release interference to the muscle and to the organ that it controls, and you heal the body. And that was my philosophy. as I treated these patients, most of them got better, but the ones that always kept me thinking is, why did I see 20 low back problems this week and patient one didn't respond? That would always bother me, because I practice chiropractic for results. That's what I'm all about, getting the results and watching these people improve. And that went on for years to me. I always thought that, right? So I went and became a lawyer. My practice grew so large that I was running a chiropractic office, at a functional medicine practice within that. And I became more of a manager of employees than a provider anymore. And I started to get burnt out from that. So I went off and became an attorney.
Oh,
and
wow.
yeah, so I met my wife in Charleston, South Carolina. And we were, fell in love, have a great response, and I brought her back. She must have liked me a lot, because I got her to move from Charleston back to West Virginia. And I was and I was a law clerk in West Virginia, and we were at a murder trial, and I received this text from my wife. She was having stomach problems, and her stomach was swollen one day, and she went to the doctors, and they told her she had cancer. So they, oh my God. So we went, and the doctor was like, it was pretty serious. She had stage 4 endometrial cancer. And the doctor wanted to start her on chemotherapy, but then she had to change a plan, thank God. And she just went in and started doing surgeries. And inside of her, the cancer was through her entire body. They had to remove part of her bowel. She was on ostomies. And the doctor told me she had about 6 months to live from there. I never told her that. It just really kind of had me all sick and stuff. And at that time, we just put our house up for sale, and we were moving to Alabama to open a law firm. And with those news, her family had a house in Vero Beach. So we came down here for her to, to try to recover from this surgery. And in the meantime, I started studying, they say when the healer's ready, the teacher will come, right?
Right.
So I was brought this form of chiropractic that is actually the beginning forms of chiropractic. It's called zone therapy, and was developed by a Dr. Thurman Fleet in the 1930s. And Dr. Fleet found that, what if the body in the spine is not interfered, but the problem is coming from the brain, right? The brain's not, it's like the brain has a virus in it, and it's not able to communicate through the spinal cord. And what he found is there's 6 points on the back of the skull that work with these neurofibrils to 6 different zones in the brain. And those zones would be your glandular system, your elimination system, your neurological system, your digestive system, your muscular system, and your circulatory system. And when you palpate those zones, you can feel tenderness on the spine. The patient can feel that. And those 4 points correlate to 4 vertebrae along the spine. So I started working with my wife, along with, she had a great surgeon, great doctor, and she took a lot of functional medicine approaches, biohacking approaches to health. But I brought into the zone treatment, kept seeing her popping up with that zone 1, all her glands were off. And I worked on her for 3 months. It took me to clear that zone. And once that zone was balanced, and we kept going to see her doctor, she's been completely cancer-free now for like 3 years, and they don't even find any cancer in her body anymore. So yeah, so it's a whole benefit of not, I don't take advantage of just the zone, because we've used diet, we've used exercise, positive mental thinking, and all that. But it's pretty amazing to watch how this zone therapy changed her life as well, and watch her health improve.
Can you explain the zone therapy a little bit? How does that work exactly?
Well, so Dr. Fleet had this, he has a therapy institute in San Diego. It's called Concept Therapy, right? In Concept Therapy, he found these zone points. The brain has different areas of function within it, okay? And those zones correlate to the different areas of the body. So there's 6 zones in that brain. So one zone will control the entire glandular system in your body. So, for example, in her, those correlate to 4 vertebrae in the body. S1, the nerves from S1 will control and regulate all the female hormones, all the glandular system of the reproductive organs. And then you have L1. L1 will regulate the areas of all your digestive and all your pancreatic enzymes in your body. Then you go up into T1, that will regulate all thyroid function. And then C1, Dr. Fleet found all the cervical zones are the most important. And C1 will work with the pineal gland and the different digestive enzymes and functions of the glands in the brain and in the body that way. So what we do is we give light chiropractic stimulation to those areas, on top of also putting the image. Dr. Fleet found, you ever sit at home, right, and you're watching TV, and here comes a commercial. Somebody likes to sit home and watch a commercial like a Days for Lads. I don't watch TV very much, but at the same time, a commercial will always come on. Do you suffer from digestive problems? You get heartburn, thus, right?
Right.
Well, that's they're putting this image. This is exactly what Dr. Fleet taught. These advertisers know what they're doing. They're putting this image of distress in your body. Yeah. And what Dr. Fleet said, the longer you concentrate on an image, that image will manifest into your body in the form of illness. Yes. So a lot of the rest of the treatment is I'm adjusting and I'm telling where it's going, but I'm putting an image of perfect health into their body. You're going to feel, and then I'll adjust them in like a digestive. You're going to feel your elimination. I'm adjusting the nerves going to your kidney. You're going to feel your urination pick up and relieve all this backed up toxins in your body. So as we continue to work and clear the zones, the imaging I'm putting in will replace the subconscious of these images that the individual has, and you'll start to see them bring in perfect health. So that's one of the whole areas of this, and this goes back, goes back before chiropractic. People, were going to France, right, to go get Christian healing. How do they do that? It's because their belief systems change, their image changes what they see, and they manifest this health into their body. And Dr. Fleet wrote a really good book on. It's called The Rays of Dawn, and it's a book about the natural laws behind the mind, body, and soul. And I have my patients read that. And me and my wife worked on a lot of the Rays of Dawns and really started getting positive thinking and positive mind thought, and not working with the negative mind thinking.
Love it.
Yeah, so that's kind of how zone work, and it's really changed me from being just mobilizing. I'm an excellent chiropractor at adjusting, but this took me to the level of healing, and I really love it.
I really think. Go ahead. Oh, sorry. Go ahead, Alex.
No, I was just going to say it's like visualization, right? It's like visualizing and manifesting, and
it is.
Yeah.
It is. You create everything. Dr. Fleet says there's these three different worlds. You have this world of imagination, right? And ideas, and all these ideas are all these, whatever you want, you bring it down into the thought world. And when you bring that idea into the thought world and you manifest, or you think about it long enough, it becomes a concept, and that concept manifests in your body. So if you want to see how people are and what's going on with them, you can look at their physical, because you can know what they're thinking and what they're manifesting and driving their health one way or the other.
That's amazing. Yeah. So just looking at a person, someone can walk in, a patient can walk in, and you can just be like, oh, wow, you're manifesting something in your gut or in your, in your arm, or your shoulder, or whatever it is. Yeah. It's pretty amazing to me. I think every illness has this mental component. It really does. It really all starts in the brain somehow. It's like something about this whole spiritual side of things where you tell yourself a story, and it happens in the body, and it creates, this kind of pain in the body. So this is a very cool technique. I love it. I know.
Right. I love it too. I've been searching. This is kind of what chiropractic was found on in the 1800s by D.D. Palmer. Chiropractors, he would teach, and he would call the big idea, right? And people you graduated chiropractic school by standing up and telling D.D., I get the idea, and they go out and practice. And they were getting people better in 5 visits. If the patients weren't better in 5 visits, they needed to come back to Palmer Chiropractic and get a refresher course on the big idea. This is the basis of chiropractic.
And I think, Emil, I mean, you're pretty unique in the sense of the chiropractors that I have met. I've never kind of heard this being talked about. I don't know about you, Molly.
No, when I go, I kind of get a very basic, adjustment here and there. This is kind of the same every time I go. but which I love because I always feel better when I leave. I always say chiropractic care is it's the one kind of care that you leave and feeling better immediately, right? When you leave, like you're like, oh gosh, I can breathe again, or everything feels better. But what I get is pretty basic. So I need to start seeing Emil now.
But yeah, well, I do the other stuff as well. That's more of a structural, functional, they call it structural approach, right? And the zone approach is a functional. So I kind of combine them both, right?
Yes.
So not everybody has, some people are in car accidents, right? So there's the whole different approach. So now we're talking an acute type of injury where it's a whole different type of treatment. Now I'm doing rehabilitation, structural alignment, and that dysfunction. So I got to change my technique and my game to the patient that way, right?
Yeah, absolutely.
Mm-hmm.
What do you think, Emil, are some misconceptions that people have about chiropractic care?
I think, did you guys ever hear about the Wilkes versus AMA case in the 1970s? There was, this was a case where the chiropractic sued the AMA for an antitrust violation, and these misconceptions are still here today. But back in the early days of chiropractic, the American Medical Association got to the point where they became so big, they were getting chiropractors thrown in jail all the way up into the 1970s. They were being thrown into jail for what they said, practicing medicine without a license. And what happened, there was the Scientologists infiltrated the AMA with a spy named Sore Throat, is what they called himself, right? Sore Throat. They were spying within the AMA because they thought the AMA was out to destroy Scientology, but what they found out, they were out to destroy their competition, chiropractic. Yeah. So they gave all that information over to the chiropractic associations, and they eventually in the 1970s sued the AMA. And the AMA lost for the conspiracy to contain and eliminate the profession of chiropractic, but we're still dealing with those plants that they put on TV commercials and everything today. And I just read one yesterday in the American Journal of Forensic Medical Pathology. They wrote a big article, big peer-reviewed study on a 43-year-old woman that had headaches and hypertension. And she laid herself on her steps, and to get rid of the headache, she put her head on the step and then twisted to the side and tried to pop the vertebrae, and she ended up having a stroke. And then the big peer review is they called that a chiropractic adjustment, and they try to attack our profession that way.
Oh, God.
Yeah, so this is what we're still dealing with today, but the facts are it's a very safe, effective form of care. I think my malpractice is like $50 a month. It's so safe. And those are some of the misconceptions you hear, is that that's one of the ones, because headaches and neck pain are the 4th and 6th leading cause of disability in America. And they want to treat that with pills. So they try to eliminate us. So that's like some of the stuff you'll hear about us.
So what about people that they think, you have a chiropractor that cracks you, right? So you have this cracking sound, and some people are very afraid of that cracking sound, and oh, does he know? Do you feel what you're cracking? Kind of, how can you put people at ease to that cracking sound? Because that's what I hear often. Oh, I can't take the sound of it. That scares people.
It does scare, I guess, some people. That sound is a cavitation. It's just gas being released, like when you pop those little shipping container popping bubbles, I'm talking about?
Oh, yeah.
That's what you're hearing. It's just release of pressure and release into a gaseous state. And you're hearing that cavitation, that release. But you don't always need that popping sound to have a release and movement of the bones. And the fact is, what we're really doing is stimulating. Each joint has what's called a proprioceptor around it. And those proprioceptors are telling the brain and communicating to the joint, telling if it's on or offline. So when you adjust that joint, that popping sound gets you the release. But the truth is, we're not really moving the vertebrae hardly at all. We're just stimulating proprioceptors to turn back on, and the brain to communicate and restore that function. So there's really nothing to be fearful of. And there's always ways. I'm able to tune my adjusting down to using different drop piece tables, and people that are very afraid, you can probably use like a little activator gun and stuff in that nature to tone it down to each individual.
Yeah.
So I would say, yeah, so I'd say there's something for everybody. Find a different type of chiropractors that specialize in those techniques and which one they seem to respond to the best.
Yeah, I feel like there are a lot of people who sort of are afraid of it. And I always think it's funny because like my daughter's been adjusted since she was like 4 months old. Like we'd been seeing a chiropractor since she was so little. And when they're even that little, it's like nothing. You barely touch their neck and it cracks, you know, it's kind of like this early stage thing with the infants. But it's amazing to me that you know, that's a lot of the fear that they have. And I feel like if people just went in and talked to you and just said, hey, like, how do I start slowly and then work up to maybe a more, you know, aggressive crack or whatnot, like there are so many options for them. Like there's the active.
There are.
Yeah, there's, you know, just like small adjustments, all different kinds of things that you can do where they don't have to feel that kind of fear and then, or maybe work up to that or, you know, one of those things. So I think there's like a lot you can do and lots of different options. I have a story. A really good friend of mine, her son was walking on his tiptoes. And, you know, I guess he was like 3 or 4 at the time. And I said, oh, you should take him to a chiropractor. Cause like that, my daughter was doing that when she was little and he like fixed it. And she looked at me and she was like, there's no way. And she took him to the doctor or to the chiropractor. And in one session, he was walking on his heels again.
Whoa.
Like, she said she could not believe it. She was in such shock. She was like, yeah, it's incredible, you know.
I see that stuff every day. It becomes like common day of my life watching how people just improve with all any types of things.
So that's amazing. What is one of the most rewarding experiences that you've had in your practice?
One of the most rewarding experiences. I tell you what, I had a young kid. I developed in West Virginia. I developed such a big practice that a lot of the neuros and the neurologists and the orthos, they would refer to me because of my adjusting skills. And they sent this young boy who had cancer and had an Arnold Chiari malformation. So I don't know if you know what that is. It's the brainstem falls down into the spinal, below the atlas, into the neck.
Oh, wow.
And yeah, and she did surgery on him, and he had all these headaches where the boy couldn't even go to school. And she said, "You think you'll adjust him? And you want to take a look at him?" And you know, most of the time I'm like, "You want me to adjust this?" And then took all these X-rays, and I said, "Yes, I'll work on him." And you know, reverse this kid's headache and help this doctor. You know, he had this horrible part of life just being dealt cancer, and just being able to make him cancer or headache free and help him enjoy life while he was here was a great experience for me. Yeah, I'll tell you a unique one I had is I have also adjust animals. Back in the day, I used to adjust animals, and I was called to this horse track, right? And they were running barrel races, and this guy spent all this money on this barrel horse. And the barrel horse, when he was running around the barrels to the left, I think it was to the left, I'm not even sure, but he wasn't running as tight around the barrel. So he spent tens of thousands of dollars flying vets in to see this horse. And I was talking to his friend one day. He's like, "I'll see if my buddy wants you to adjust this horse." So we come up there, I adjust this horse, and afterwards he put him into the horse trailer, and he's like, "I just can't get him to turn his head to the left anymore." Because you think this worked, and you look at the horse trailer and his head's out, and he's got his head all the way turned to the left, looking back at us. Like, I think this works, my friend. That was a memorable one for me.
That's funny.
How do you adjust a horse? How does that work?
Now there's little courses you can take on it. There's little techniques on it. Yeah. So I'm so into chiropractic. Back in my younger days, I took these courses on it and learned some of those techniques.
Wow, that's
amazing. That's amazing.
Yeah, it was funny. That was a good one.
Emil is he's like a vet, a chiropractor, and a lawyer.
And
like,
my own.
What don't you do at this point?
I mean, it's incredible. Yeah. And he looks like a Viking, like a giant Viking. So yeah, I mean, it's just fabulous. It's so great. Molly, do you want to shoot on with the next question?
Yeah. So where do you see, the future of chiropractic care going? Is there anything interesting, in the next like 5 to 10 years coming out?
What I saw just interesting, the University of Pittsburgh's bringing a chiropractic school mainstream now. So now they're getting into the state system. I see Duke University's talking about bringing chiropractic program in. Schools are opening up in Seattle and Omaha, so it's starting to really grow. There's probably, that's one of the problems. There's only 60,000 of us in the world, and now it's really starting. This younger generation is starting to see the need for function and health as opposed to treating symptoms, and I see it really growing now.
What's amazing is like every major like football team, basketball team, baseball team, like they all have chiropractors on their staff. And anyone who ever says to me like, oh, like, chiropractors, I occasionally, every once in a while, run into someone who's like, oh, like, I don't think a chiropractor is a real doctor. And I'm like, but then why would every major sports league have one on their team,
Right.
Like it just seems sort of crazy, right? Because it's so needed, especially if you're that active, if you're that much of an athlete, and constantly throwing your spine kind of out of whack, you really need regular care, right?
You do. It goes back to that AMA's attack on the profession. We're still fighting all these lies they created on this profession. And the reason you do that to somebody to try to contain them is because you're afraid of what they're going to bring to the table.
Right. Because you're their competition.
Right.
Get rid of you because what you do, right? That we see that all the time. We had a discussion with Dr. Hockey about that, about peptides being pulled off the market because they were competing too much with certain pharmaceutical drugs. I mean, this is kind of how the system works, right? We live in
how it works. It's sad.
Competitive place, and so there's many different ways to get rid of your competition. So it's all very interesting, right?
It's very interesting.
Yeah. But we know you're needed. And, I tell you, like, when I go to the chiropractor, the main stuff I do especially is like, if my daughter is sick or if I'm start to feel sick, I'm like, we're going right away. Like, because then, and especially like if my daughter even has the slightest sniffle or like even the beginnings of what might be kind of like an ear infection or something like that, like we go in and boom, like she's better, the next day. So it's a huge like thing for immunity too. I think people think, oh, I should only go to a chiropractor if I have like a spinal issue or a back pain or something like that. But it's really like a whole host of reasons to go.
Yes, that's kind of how that zone comes into play. Is exactly what you're talking about, because you're influencing the organs controlled by those nerves as well.
Yeah, exactly. So with how does it work with immunity?
Well, immune system is, upper cervical stuff as well. But how does the zone work with immunity?
Yeah.
Well, the zone's working. The zone is looking at the image. Say, for example, you were raised with a mother that says you need to it's going to rain outside. You got to have your rain jacket on, right? And this is put into your head all the time. Well, it's raining outside, and I didn't put my rain jacket on today. So this has been going on for 20 years. So you're going to get sick. Your mom will say, if you don't wear your raincoat. Well, now you're 30 years old and you go outside and it rains, you have your raincoat, but in your mind, you have that image of, wow, I forgot my raincoat, so I'm going to be sick. So that's how that's how the mental part of that would come into play, you see?
Yes.
As the physical part would be the bone, what you went in for with your daughter was the structural part, right? The structural part of where the bone was out of a line, interfering the top vertebrae most of the time, dealing with immune system function that way. So your chiropractor released the top vertebrae and released the immune system, and so she was getting a structural component to that. So you see how the two different areas can work, right?
Yeah. Oh, that's very cool.
Yeah. So Emil, today I was in the gym, and when I run on the treadmill, I slightly dance and kind of sing a little bit. Yeah, and this man came up to me today. This is the first time ever. So I'm actually I am in an amazing zone, right? I'm using a lot of what you're talking about, like visualization, and I feel myself being stronger and stronger, and just like my cells are just like bustling with health and vitality, right? So
Right.
this man came up to me today, a really miserable 70-year-old or like mid 70s, whatever. At least he looked that age. Maybe he was 50, but he was so miserable that he looked older. He said, he stopped me and he goes waving to me and he's like, "Are you okay? Are you really okay?" And I said, "Sir, I am more than okay. I am fabulous." And that irritated him even more, right? But
Right.
but I thought it was brilliant. And I'm like, what a shame that this guy is obviously, he's vibrating so low. He is obviously not utilizing these techniques. I'm very aware of these techniques because, it's obvious it works, right?
It
And
does work.
no, 100%. And
That's why you're always on fire the way you are.
that's right. I'm on fire because I
Right.
visualize myself, right?
Right.
Yeah, no, it's true. It was quite interesting. I've never had anyone saying that to me, but that happened today. So
Well,
anyway,
Alex, don't you go walking down the street when you're walking your dog and say to yourself, Alex is doing amazing today.
yeah, yeah.
And
Well,
her
that's
husband's like
yeah. I do that in front of my husband he really irritates. He really gets irritated. Alex is great. Yes, she can do anything, and he's not too happy with that.
so it's important to have those positive things. And I think actually if you say them out loud, or if you're on the treadmill and you're, living that positivity, I think that's such a huge factor in, your health and how you feel. It's just like throwing out all those positive vibes. So it's great. It's a
Yes.
great practice.
Yes. And you're hoping that it will kind of like, my hope is that that good energy is kind of like sharing it with other people. That's my hope, right? That it's like vibrating all these good vibes, right? But I guess
Right.
some people are not receptive to it and it makes them actually angry because they're dark, right?
Right. You try to lift their frequency right up to your level, bring them up.
Right, exactly. I should have sent them in to Emil, right? To sort him out.
Yeah, exactly.
Right? Should have given him your card. Um,
Right.
Emil, tell me, like for the audience, what are some simple practices that people can do at home to improve their spinal health? Like, is there something that you can recommend? Kind of
Well,
a
yeah, for
general.
example, one thing I can recommend, well, a lot of us suffer what we call lower cross and upper cross syndromes. So, our bodies are, we are meant to be developed as hunter and gatherers. We're meant to, as tribal people being able to squat and not sit on chairs and stuff like we do today. So our bodies adapt to these postures that we improperly put on them. So we become what's called an upper cross syndrome. Our muscles form a cross, right? So our muscles in the front, the neck flexors in the middle and lower traps will become weak, while the pecs and the upper traps become tight. So we've got to focus on stretching the tight areas and strengthening the weak areas. The low back is the same area. So we get tight areas in the hip flexors and the hamstrings, and our glutes and our abdominal muscles become weak. So those hamstrings and those hip flexors need stretched, while the abdominal muscles and the glutes need strengthened. So a lot of times my patients, I'm always sending them home with these type of exercises to do. And these are areas they can go home and focus on now, stretching upper trapezius and levators and the pec muscles and door frames and stuff in that nature, stretching that out. Or when they're sitting, I see a seating, you can find these on Amazon if you just Google seating disc. A lot of people will take these lumbar supports and put them in our back and try to force the lumbar into its natural curve, but functionally the body doesn't. The lumbar will naturally reverse its curve when we sit. So how we keep a nice curve into our lumbar while we're seating is to sit on a seating disc, and that seating disc will put our pelvis in a little bit of a forward tilt, and that will naturally keep the lumbar's curved that way. I get that question a lot in my office. What can I, my chair at home's hurting me, or my office desk. And I usually always recommend those seating discs. And there's a lot of research out on that, as opposed to versus the lumbar, the support that people use. So those are some good examples right there structurally.
Very good. What about, like, I think a lot of people, like including myself, pillows, yeah? You recommended me a pillow. Can you share that with the audience? Like, because that's, we lay down on that bed and on that pillow for, 8 hours or 9 hours or whatever. So is there some kind of trick to that, or, what pillow should you be choosing?
That's a good question. That goes right along with that upper cross syndrome. You see, when we have weak neck flexors and weak middle traps, our neck naturally goes forward and we lose our cervical curve. That cervical curve is so very important. So pillows, we want to find a nice orthopedic type of pillow with a curve and a hole in the middle where you can lay on your back. Most of the time sleeping, you want to lay on your back and have that little brace. Sometimes I tell patients just to roll up a towel while they sleep and put that under the neck. And if that feels comfortable to them, then get one of those type of pillows has like a little indentation in the middle and it forms a lump where the neck should fit in. And they have two different sides. And then if you're a side sleeper, you want your head to be sleeping just like you're standing. You don't want to twist it laterally flex too far towards the pillow or too far away. So you only want a pillow the thickness between your shoulder and your neck from side sleeping, and definitely no stomach sleeping. That just constantly, you get no regeneration when you're sleeping at night by sleeping on your stomach, and you wake up stiff and sore, headaches, and no recuperation at all that way.
Molly, how do you sleep, Molly?
Well, I go back and forth, but I can't sleep on my side because I feel like my shoulder always goes to sleep. So I don't know how people do that, but like I'm either on my back or on my stomach, but now I feel like I should avoid the stomach.
Yeah, you probably should avoid the stomach.
I like to kind of fall asleep a little bit that way, but then I usually wake up sleeping on my back. What about you, Alex? What do you do?
Oh, side and back. Like, I used to be stomach, but never anymore. So really my left-hand side or my back. I start on my back and then side.
Yeah. Your shoulder doesn't, why does my shoulder fall asleep? That's a good question.
Dr. Emil, why?
Probably something in her neck level as well. Or we'll see how I could imagine how if the head is, when you're on your side, if your pillow's too small, you're going to have too much lateral bending to the side you're sleeping on. If it's too thick, too much laterally bending away. But my main idea would think is from sleeping on your belly, because of all, when you sleep on your belly, you have to have cervical rotation, because you're not going to, your nose is not going to be in the pillow breathing. You're going to turn your head to the side to breathe. Right. So when you turn your head to the side, you're going to get cervical rotation, but with cervical rotation comes cervical coupled with lateral flexion, and that will compress those nerves all night. That's what would do it, I would suspect.
Got it. Okay. So you like back sleeping best generally?
The best, yes.
Okay, that's the best. Yes. Got it. I heard someone, so I think I had a physical therapist once tell me that, like, when you like to sleep on your stomach, it has something to do with like feeling safe, like it's like this heaviness on your organs or something. And she said, like, if you're a stomach sleeper and you want to start sleeping on your back, like use like a weighted blanket or something, and that gives you that same feeling of like safety or protection, whatever it is.
Little hack.
Well, it's a great idea. Goes right along with that positive thinking and stuff. Yeah, it's a great idea.
Yeah, I like that. Very good.
Cool.
Emil, what do you do daily yourself to maintain your own, vitality?
Well, first thing I start off with is I wake up and with gratitude, I read some Bible and get myself in prayer and get myself ready to heal others. And then I, try to eat clean all the time. We try to follow more of a keto type of diet, try to exercise 3 to 4 days a week and load up on water. And I read a lot of Dr. Fleet's Raise the Dawn in the evening. I stay away from like the news and TV and any type of those type of polarizing debates, and try to stay positive like Alex does all the time and focus that way. And that's what I try to do. Try to put every day into that so I can hit my mind, hit my diet, and hit my physicality to keep that functioning the best I can.
I love it.
That's like the best advice. Yep.
Yeah.
Yes.
Plus I get adjusted regularly. You know,
Right.
So, hang
Obviously.
on, who adjusts you?
my brother's a chiropractor.
Oh,
Yeah.
brilliant.
Yes.
Yeah.
But he's not in town.
No, but then you know, I taught my wife some techniques on my tables. I get her to I have what's called a drop piece. You know, I've been adjusted probably tens of thousands of times, so my spine moves so easy. I just know where it is, and I teach her how to set up on it and drop me right in the face. She's good too, believe it. I mean, I was a chiropractor professor, and her adjusting skills are up there with third year's chiropractic students.
Wow, I love it.
Yeah. Now she's going to be a chiropractor too at the end of it.
She is. I call her the chiropractitioner. Can't call her chiropractor.
She is your wife is such a, she's a natural healer though. That's really what she is.
She is. She's a dentist, and she is a natural at it.
Yes.
She really knows how to talk and calmly and bring into that healing just with her voice. So definitely, she's really good in my office. She's kind of working in my office right now as we're building it, and you know, I'd say half the healing starts with her when they come in, just to see in her. She's like a guiding angel that way.
Yes, she's like an angel. Yeah, that's great. Emil, do you want to tell the audience what, or unless, do you have any more questions, Molly, for Emil?
I don't. I think we're good. Yeah.
I think it's great. Do you want to tell the audience how they find you?
Yes, you can find me on my website, emilchiropractic.com. That's EMIL chiropractic.com. And you can find me, I'm in Vero Beach at 58th Avenue in the Rhinewood Plaza, next to the Italian Grill up in that region there. So that's where I'm at.
Fabulous. And do you have any socials that people can look at?
Yeah, I have Emil Chiropractic on Facebook. And I think that's about it. I think that's all I have.
That's all right. That's a good start.
Yeah, good start.
Yeah, that's great. No TikTok yet. No TikTok.
No, I don't do that. I do a lot of, you know, mostly I work with a lot of attorneys, so I see, you know, I bring that law and chiropractic together. So my specialty is really taking these car accidents, which are really hard to treat, and fixing those. That's what I enjoy too. So I take the chronic stuff with my zone, but I take my acute stuff with all these vehicle accidents, and really it's like repairing that as well.
Incredible.
Yeah. Yeah. I know car accidents are so prevalent these days. So I would imagine you have a lot of business in that way. Well, so people should know that too, that they can come to you for that. I think
right, because that's you know, the first, fourth, and fifth leading cause of disabilities: low back pain, neck pain, and headaches. And you know, that's all mostly stems from old ligament injuries. Anybody that you see that has pain, they've had ligament injury somewhere in their body. So you know, the spine's only made up of bone and ligament and disc. And you know, you get an MRI of the disc, but no one ever looks at those ligaments, and that's what needs to be the muscles around that area to get those ligaments functioning again. And that's kind of really what I've been pushing all my work into lately, is really studying ligament damage and rehabilitation of it.
Super.
Yeah.
This is great. Emil, I will see you in real life in 45 minutes.
Excellent.
Yes, you can work in crack and all that stuff on me.
All right.
I'm very excited. But thank you so much. Thank you so much for being on our podcast. I think you were super informative, and I think the audience learned a lot.
Well, thank you for having me.
Thank you. So it was fabulous. So thank you so much for sharing all of your great knowledge. And I think people are going to be running to your office now.
Well, thank you. I'll talk to you soon.
Bye.
Bye. Bye, everyone.